Mycoplasma synovae infection, the alternative name MS, infectious synovitis. Definition: predominantly a subclinical upper respiratory infection of chicken, turkey. Systemic infection results in an acute or chronic condition of chicken and turkey characterized by inflammation of synovial membrane and usually by oxidate in the joint and tendon sheaths of many infected birds. Synovial involvement is referred to as infectious caries. Mycoplasma synovae infections are common in multi-age commercial layer flock and are predominantly subclinical. The infectious synovitis form occurs in chickens, especially in broilers, but the disease is usually seen in young 4 to 12-week-old chicken or young 10 to 12-week-old turkey. It has been seen in adults layer in chicks as young as 6 days. Historical information: infectious synovitis was first described in chicken in 1954 and in turkey in 1950. Etiology: the etiological agent is Mycoplasma synovae MS, a fastidious organism that require nicotinamide adenine dinucleotide form. Mycoplasma synovae is fastidious organism. It can usually be grown in 5 to 6 day old embryonated chicken eggs or in special mycoplasma media. A commercially available PCR test can rapidly identify MS positive flock. Cross reaction usually don't occur when hemagglutination inhibition or ELISA tests are used to separate Mycoplasma synovae from Mycoplasma gallisepticum. Epidemiology: Trans-ovarian transmission is an important means of spread of infectious infections. Also spread horizontally via the respiratory tract. Such spread is slow and only part of infected bird develop jointly. The organism has a predilection to localization in synovial line structures such as joint, tendon sheath, and blister. It also localized in the ovary and occasionally in the air sac or sinus. Clinical signs: lameness in many birds and the tendency of affected bird to rest on the floor are prominent here. Many affected birds have pale head bars and swollen hocks or food bags. The feces of acutely affected birds often are green. Affected birds become dehydrated and thin because of failure to eat and drink regularly. Morbidity is usually low to moderate but may be high if there is damp or cold weather or the litter is wet. Mortality is usually less than 10% unless there are other diseases present or the husbandry is poor. A slight transient egg production drop may be observed in acutely infected. In the early phases of synovitis, most synovial line structures, joint, tendon, sheath, contain a sticky viscid gray to yellow exudate. This is usually more voluminous in swollen hook or wing joint or under swollen food pads. Later stage of the disease, the bird may be emaciated or thin, and there may be no lesions in the internal organs. Exudate in joint and tendon sheath may be inspissated or joint surface may be. Diagnosis: typical signs and gross lesions, especially episodics, lameness and characteristic exudate in swollen joint or tendon sheath are suggestive of synovitis. The diagnosis can be traced by obtaining positive plate agglutination test for synovitis on sera from Mycoplasma synovae can be isolated on special media or in 5 to 7 day embryonating chicken eggs. Tracheal sinuses, air sac or synovial exudate are preferable for culture. The isolated mycoplasma can be identified by direct fluorescent antibody technique applied to colony. Exudate may be inoculated onto the food bag of a chicken or turkey to reproduce typical lesion. Later, their pre-inoculation and convalescent sera may be tested again. Mycoplasma synovae antigen and Mycoplasma gallisepticum antigen. The HI test can be used to confirm agglutination test result. A commercial PCR test specific for Mycoplasma synovae is available. Tracheal swabs from a number of birds. Synovitis must be differentiated from arthritis caused by staphylococci, fowl typhoid, Pallorian disease, and viral arthritis. Agents of the first three are easily cultured. Viral arthritis should infect experimentally inoculated chicken, but not in most areas. It's now possible to get chicks or poults that were hatched from eggs from SMS3 flocks. If possible, start with such chicks or poults. As far as possible, raise the birds in quarantine under the all-in, all-out system. Synovitis can usually be prevented by continuously giving the bird a low-level antibiotic in the feed. This is an expensive procedure. Many antibiotics used for treatment can be used for prevention but are fed at low level. Commercial mycoplasma synovae vaccine is available and may be beneficial in certain management situations. Treatment of lame birds with well-established synovitis is usually not very satisfactory. A relatively high level of antibiotics are required and may be given in feed or water. Tetracycline have been widely used. Streptomycin has been used intramuscularly in small groups of birds where they could be handled individually.